As the U.S. hits a new record for daily coronavirus cases, the true number of infections is likely 10 times the number of reported cases, said Robert Redfield, director of the Centers for Disease Control and Prevention, on Thursday.
That means officials estimate that 20 million Americans, or 6% of the nation's 331 million people, have actually been infected, meaning the vast majority of the population remains susceptible.
Meanwhile, coronavirus cases are trending upward in about half of U.S. states, and several have reported record-breaking daily new case counts this week, according to Johns Hopkins University. The U.S. reported 39,972 daily cases of the coronavirus on Thursday, a new daily record, according to a database maintained by Johns Hopkins University.
While some states are pushing ahead to the next phase of reopening, Texas hit pause on its reopening plan Thursday and suspended elective surgeries in the state's largest counties. The state reported record-high new daily coronavirus cases on Tuesday, Wednesday and Thursday, when it also broke its record for hospitalizations for the 14th day in a row.
Alabama and Missouri also reported record-high daily increases Thursday, according to the respective health departments.
Here are the most significant developments of the day.
Upward trend. Today's stats. Worldwide infections have surpassed 9.6 million, with more than 2.4 million in the United States, according to Johns Hopkins University. More than 489,000 people have died worldwide, with more than 124,000 deaths in the U.S.
Newspaper. What we're reading: summer is here and it's going to be hard to stay inside. With the right preparation, though, you can lessen your risk for getting the coronavirus. So take this quiz: are you ready to join the COVID-19 world?
Our live blog will be updated throughout the day. For first in the morning updates, sign up for the daily briefing.
18 members of a North Texas family tested positive for COVID-19 after attending a surprise birthday party in late May. Only one member of the family unknowingly had the virus at the time of the party, WFAA reports.
We knew this was going to happen. I mean, this whole time this has been going on, we've been terrified, Ron Barbosa told WFAA.
Barbosa, who is a volunteer EMT, and his wife, a doctor, chose not to attend the party, which was hosted by his nephew, due to safety reasons. Barbosa said his family suspects his nephew, who had a slight cough at the time of the party, was the family member who was unknowingly infected after possibly being exposed at work.
Those infected include 2 young children, Barbosa's elderly parents and his sister, who is battling breast cancer. Barbosa's father, Frank, was admitted to the hospital on June 17 and placed in the intensive care unit soon after, where he remains. While it appears that most of Barbosa's family is on the road to recover, the experience serves as a warning for what could happen even when proper safety precautions are attempted. Barbosa says all 25 people who attended the party attempted to remain socially distant, and not all of the attendees were there for the entirety of the party. Lauren Mitchell, Austin American-Statesman. Groups representing workers and actors at Walt Disney World are calling for the theme park to delay its planned July 11 reopening as coronavirus cases surge in Florida. On Thursday, the Actors Equity Association, which represents about 600 professional actors at Disney World, cited Disneyland's postponed reopening in California in calling for the same at the Florida parks. Disneyland said late Wednesday that the park would not reopen as planned on July 17. If Disneyland has postponed, it is unclear how Walt Disney World can responsibly move toward reopening when coronavirus cases are much worse in Florida, said Mary McCole, the Actors Group's executive director, in a statement. Andrea Finger, a spokesperson for Walt Disney World, said the park's reopening timeline has not changed. Curtis Tate. 3 beach towns on England's southern coast declared a major incident Thursday after thousands defied coronavirus social distancing rules and flocked to the shore on what has been the hottest day of the year in the United Kingdom so far, with temperatures in the low 90s. We are absolutely appalled at the scenes witnessed on our beaches, particularly at Bournemouth and Sandbanks, in the last 24 to 48 hours, Vicky Slade, leader of the Bournemouth, Christchurch and Poole Council said in a statement on their website.
The irresponsible behavior and actions of so many people is just shocking, and our services are stretched to the absolute hilt trying to keep everyone safe.
The decision to declare a major incident, as Slade said, gives additional powers to local authorities and emergency services to tackle the issue. She said they are also deploying additional resources to provide increased patrols in the vicinity to help tackle any issues of antisocial behavior and other offenses being committed.
Morgan Hines.
Breaking from earlier guidance, the Centers for Disease Control and Prevention said Thursday that pregnant women may be at increased risk for severe illness from COVID-19 compared with non-pregnant women.
The good news is that pregnant women who are infected with COVID-19 aren't at any greater risk of death than women who aren't pregnant, according to the CDC.
The worst news is that infected pregnant women are more likely to be hospitalized and are at increased risk for ICU admission and to require mechanical ventilation, according to a CDC study of thousands of women in the U.S. from January to June.
Among women with COVID-19, about 32% of pregnant women were reported to have been hospitalized, compared with about 6% of non-pregnant women, the study found.
It's possible, but not known, that the higher hospitalization rate might be due to doctors' overall concerns for the health of pregnant women, so they could be more likely to admit them to a hospital, CDC officials said.
Elizabeth Weiss and Grace Hawk.
Health officials are asking Americans to socially distance this Independence Day, saying that they are concerned about the surge in coronavirus cases after the U.S. on Wednesday saw its highest daily number of new cases in months.
Those numbers only represent about 1 in every 10 cases, said Robert Redfield, director of the Centers for Disease Control and Prevention, in a press conference Thursday.
While we're still in the first wave, Redfield said the pandemic today looks markedly different from the outbreak 2 or 3 months ago, when many deaths were among older people and those with underlying medical conditions.
For the 4th of July, which is a family event, we want to emphasize that it's really important that we get back to being vigilant as our collective commitment, to protect vulnerable friends, family, community.
Elizabeth Weiss and Grace Hawk.
Fewer Americans are seeking unemployment benefits, but the number who need help remains high as the country haltingly reopens its economy amid the coronavirus pandemic.
Last week, 1.48 million workers filed first-time claims for unemployment insurance, the Labor Department said Thursday. That latest round of applications means a staggering 47.1 million Americans have made initial jobless benefits claims in just 14 weeks.
Initial jobless claims are the nation's most reliable gauge of layoffs, and in an investor's note, Oxford Economics said the latest numbers paint a picture of a job market in turmoil. Initial claims fell only slightly from last week, reminding us that layoffs in some areas remain widespread.
Sharice Jones.
More than 1 million dead people received coronavirus stimulus checks from the federal government after the Treasury Department and Internal Revenue Service failed to use death records when distributing the first 3 batches of direct cash payments to Americans, a government watchdog agency reported Thursday.
As a result, nearly 1.1 million payments totaling nearly $1.4 billion were distributed to dead people as of April 30.
Reports of dead people getting stimulus payments surfaced in April when the IRS began making direct deposits of up to $1,200 into taxpayers' bank accounts. The payments were authorized under a new $2.2 trillion recovery package, known as the CARES Act, designed to help the economy recover from the catastrophic effects of the coronavirus pandemic.
The Treasury Department announced last month that people who received a stimulus payment on behalf of someone who is deceased should return the money immediately.
Michael Collins.
Texas Governor Greg Abbott on Thursday halted the state's reopening plan and suspended elective surgeries in its largest counties in order to expand hospital bed availability for COVID-19 patients.
The state broke its record for hospitalizations for the 13th day in a row and reported 5,551 new cases Wednesday, state health officials reported.
The state is in Phase 3 of Abbott's plan to reopen, which allowed restaurants to increase occupancy levels to 75% and most businesses to move to 50% occupancy. Abbott declined to roll back those orders.
The last thing we want to do as a state is go backward and close down businesses, Abbott said. This temporary pause will help our state corral the spread until we can safely enter the next phase of opening our state for business.
The surgery order goes into effect Friday and will require all hospitals in the 4 designated counties to postpone surgeries and procedures that are not immediately life-threatening. The governor can add or discard counties included under the executive order as surges may arise or dissipate within the state.
Nicole Kobler, Austin American-Statesman.
How is your summer going amid the pandemic? We want to hear from you, especially if you are caring for loved ones. Your story could be featured in our daily news podcast, 5 Things. To share your story, go to coronadiaries.io/USA Today. Choose the first prompt, follow the instructions, and record a brief audio message.
Coronavirus Watch. Sign up for our daily coronavirus newsletter here. And come together and share the latest information about coronavirus, coping with lifestyle changes and more by joining our Facebook group.
Timeline. It's been 5 months since the Centers for Disease Control and Prevention announced what was thought to be the first confirmed coronavirus case in the U.S. Read how the pandemic unfolded here.
Contributing, Associated Press.